Hello, everybody. Welcome back to the podcast. We have a very exciting conversation today with a very special guest. Some of you may know Dr. Scott Sherr. And well, surprisingly enough, Dr. Sherr, I had came across you on Instagram and YouTube over the years, and it wasn't until I connected with your team that I went, oh, I know him. I was like, yeah, let's have a conversation. So, for those of you who don't know Dr. Sherr, he's a board certified internal medicine physician and the COO of Troscriptions. He is certified in health optimization medicine and specializes in hyperbaric oxygen therapy. Scott's mission is to make complex science easy to understand and apply, which hopefully will help you do that today. And through his clinical work and experience teaching and media appearances, he helps people and practitioners use different principles to boost brain health, energy, and resilience. He is known for clear, actionable education, and hopefully we can bring that to the conversation today, Dr. Sherr, right?
That's the hope here, Shaman. Thank you for having me. It's nice to be here.
Well, thank you for making the time. Your schedule is a lot busier than mine, and mine is pretty busy. So,
I
how,
also have four kids, so there's also that too. I
oh
never,
yeah.
I never know when they're going to knock on the door, but I think we're okay. So,
Yeah, or Amazon will ring the doorbell, and I'm like, damn it, I hope they didn't hear that.
well,
So
as long as you have a dog like barking every time the Amazon guy comes, I have that. So,
how's your day going? Pretty good.
oh, I'm good. I'm good. Good. It's good to be with you. It's good to be. It's getting a little bit nicer here in Colorado. Got some nice days ahead of us. So, always happy to be on a conversation talking about some fun stuff too.
Do you still have a lot of snow there in Colorado?
We didn't get much this year. The western side of the United States, it was the driest and the warmest that it's ever been this year. So that's nice on some level, but it's also a little bit scary because if there's not a lot of snowpack, things can get a little dry, a little fire risky at the end of the year. So fingers crossed we get a couple more snowstorms. You can here in Colorado, it can snow until Mother's Day, which is in the U.S. mid-May.
May
So
10th, I think it is, if
May
I'm
10th, I
correct.
think that sounds something around there. Yeah.
Just
So we've
remember
definitely
that for
definitely had
your wife.
snowstorms. Yes, I'll remember as the time gets closer. She always loves it because it's always there's always something scheduled for one of my children that day. Like they always have a soccer game or something. It's just like, why do they always do this? But that's how it goes.
Well, this is the choice we make when we decide to be mothers. So,
Indeed.
I invited you on the podcast to discuss methylene blue. Methylene blue is something you utilize a lot in your clinic. You speak
Hmm.
about a lot. You've been on a lot of podcasts and different appearances, and your company in itself pretty much, for lack of a better word, preaches the benefits of methylene blue. So a lot of people have heard of methylene blue because it's one of those trendy kind of terms, the same as red light therapy and all the other
Hmm.
things.
Hmm.
But most people don't even know what methylene blue is, apart from maybe fish tank cleaner, and you
Yeah.
probably
Yeah.
shouldn't ingest that one.
No, please don't. Yes. Thank you very much. Public service announcement there. Yeah.
So, can you tell us, let's start with the basics, what exactly is methylene blue?
Sure. So yeah, my company, Transcriptions, as you mentioned in the intro, pioneered the commercial utilization of methylene blue, meaning that before us in 2020, you couldn't find a commercial product that had methylene blue in it. So we were the first to do it back then. But way back then in 1870, 1870s, 1870, that's when methylene blue was actually first developed. It was first created. And it was initially created as a textile to dye blue jeans and other things very blue. So if you owned a pair of Levi Strauss jeans in the 1870s and 80s, it was dyed with methylene blue as the color. What was interesting about the time, there were no antibiotics around. There was really no way to treat infection other than would have been treated for infection otherwise like plants and herbs and things like that, but many of that wasn't really around, especially in the western part of the world in the United States. And so they were working with a number of different compounds, and they figured out that methylene blue could kill pathogens at very high doses actually, and it wouldn't harm the human host at the same time. So that was kind of the reason why it was called a magic bullet at the time. And in 1897, it was the first drug registered with our FDA in the United States for the treatment of malaria.
Hmm.
And from about 1897 to about 1950 or so, when antimicrobials came on the scene, it was the primary antimicrobial, treating fungal infections, bacterial infections, viral infections, parasitic infections. If you were a soldier in World War II and you were going to the Pacific, the West, where Japan was, or the islands around Japan, you were taking it prophylactically. And they had songs about going blue in the loo. You'll know this as being from Ireland. This is what you guys call the washroom, the restroom is is the loo,
Gonna go to
and
the
it's
loo. Yeah.
going to go into the loo. Yes, going blue in the loo because methylene blue, when you ingest it, when it comes out of the body, it goes through your kidneys and through your bladder, and you urinate it out. So you urinate blue if you take methylene blue. So don't be surprised. You take some methylene blue, your urine's going to be blue. If you've had B vitamins that morning, and your B vitamins make your urine
It'd be
quite yellow
green.
sometimes, you get your neon green going on, right? And so as a result of antibiotics coming on the scene in the 1950s, methylene blue became less used because, well, you had these cool new drugs, and certainly penicillins of the world have been, transformative to medicine in many good ways. Uh, but I mean, there's obviously bad things about antibiotics too. One of them being that it's kind of like a nuclear bomb for your gut, meaning that every time you take an antibiotic, you kill off all the bacteria in your gut at the same time. Where methylene blue has a very interesting capacity to only be more selective to what's actually causing the issue, especially if you use it for short periods of time. If you use it for long periods of time, like months, then it's going to kill off other stuff too. But for short periods of time, it kills off bad biofilms. It kills off bugs that we don't like, especially. And then it's now coming back in favor because a lot of the drugs we use don't work as well, the antibiotic we use, because the bugs have become resistant, but not to methylene blue because of its interesting mechanisms of action, specifically by increasing hydrogen peroxide in the system. That's something you can buy at the store. That's something that your cells make on a regular basis to kill bugs and to kill cancer cells and a bunch of other stuff too that shouldn't be there, even your cells themselves that shouldn't be around. So after that, after the 1950s, methylene blue had a little bit of a different, separate number of chapters. The next chapter it was developed as the primary molecule where a number of antipsychotic drugs were developed because methylene blue increases norepinephrine, serotonin, and in higher doses dopamine as well. So the first antipsychotics were derived from methylene blue. From there, it became something used in chemistry class. And this is how I learned about it actually when I was in chemistry, because methylene blue concentrates in parts of your cell. Where does it concentrate? It concentrates in the mitochondria of the cell. And this is where things get interesting. And this is where our conversation really will be becoming more, I think, applicable to most people that are listening, is that methylene blue concentrates in the mitochondria. And then, well, what is it doing in the mitochondria if it's concentrating there? And so now we have decades of studies showing that methylene blue can concentrate in the mitochondria, helping with energy production and helping with detoxification at the same time. There's very few compounds out there that do both. Most will help with you making energy or will help you with detoxification, but very few do both. And we can get into the details there if you'd like. But in general, methylene blue is a fantastic mitochondrial support. And so now fast forward, many 125, 130 years later, we're using methylene blue at low doses for mitochondrial support, and we're using it at higher doses again as an antimicrobial because it still has that capacity as well.
It seemed to go quiet for a couple of decades, the whole methylene blue conversation. Then it popped back up during the 2020 to 23, 24
Mhm.
fiasco. And then people were using it as alternative medicine, and that's where it started to get the limelight again. Did you notice that?
Yeah. So when we first started talking about it, people thought we were crazy, actually, because this is right before the pandemic. The studies that we were looking at were based on cognitive performance using methylene blue.
Mm.
And the reason why methylene blue is so great for cognitive performance is that low doses work in the mitochondria. And where do we have the most mitochondria per cell? Not the brain, actually, in your reproductive organs. So your eggs and sperm are number one and number two, and eggs are number one, and sperm is number two. The third, though, is your brain. So if your mitochondria aren't working very well in your brain, well, you're going to have brain fog, you're going to have concentration problems, mental health problems, mood issues, mood disorders, et cetera. And so we were looking at the data with methylene blue, looking at it specifically there. So people thought we were like, and we were coming out with a nootropic at the time. That's kind of how we developed it. We developed our first product that had methylene blue in combination with a little bit of caffeine, very low dose nicotine, and CBD called blue cannatine. And that one off the gate did take off, but it wasn't the zeitgeist there. It wasn't people. But as soon as COVID started happening, then they were looking back. There was a study that was done right before the pandemic that showed that methylene blue can neutralize coronaviruses. And all of a sudden it's like, oh, what is this compound? This is very interesting. And so during the pandemic, we couldn't really talk about methylene blue as an antiviral. But look, if you lived in a Soviet country until the 1960s and you had a sore throat as a kid, your mom would paint the back of your throat with methylene blue because it's a fantastic antiviral. And then all you did was you had the kids go out in the sunlight and open up their mouth or go out in the sunlight if they had like a different type of infection, because sunlight combined, the red light of the sun along with methylene blue, increases energy production, that's for sure, but also at higher doses is fantastically antiviral and anti-infective as well. And so during the pandemic, we had people taking methylene blue, getting in front of their red light panels or going out in the sunlight, and getting much better, much faster. Certainly there was other things that we were doing. So it was, about June of 2020, so 6 months into the pandemic or 5 months, that's when we released Just Blue, our pure methylene blue product. Because before the pandemic, we didn't think there would be a market for a pure methylene blue product, but then we got request after request. And so we couldn't even make it, like we made it in a manufacturing facility, but we couldn't even get the packaging from China at the time because everything was shut down.
Toilet roll, the whole lot.
Yeah. So we had to we did little packet. It was a whole we would say MacGyvered way of doing it. Like, I don't know if people know MacGyver, but it was like figuring out how to do it. Right. And so that was the first wave was COVID for sure. Then I started talking about it at conferences. I was talking about it in 2023, 2024, in 2025. In the clinical world, it was starting to become a thing. And then in 2024, it was becoming a thing. Then in 2025, RFK, the Human Health Secretary here in the United States, was on a plane using methylene blue. And then there was a couple people on Joe Rogan's podcast talking about it. And then it was like, holy crap. And then everybody, the zeitgeist became, like you said, red light therapy. Like it became something that was sort of added in that conversation. So that's the main history of it. But we certainly have pioneered the market and really understand it better than I think anybody else out there.
It definitely became super hip over the last 12 years. As soon as that kind of headline of RFK doing it,
Yep.
and of course you had the mainstream media like, oh my God, he's using methylene blue. What will he do next? And it was so awful. But those of us obviously in the know were like, this is not a big deal. It's not like he's drinking Lysol or toilet fluid.
Right.
But I think during COVID, people were trying everything and anything. They're like, anyone who was into natural or alternative medicine, they're willing to try anything and everything. And methylene blue was definitely up there. And I know for me, Ben Greenfield was a big influence there. He was obviously one of the original biohackers, but he was known for having a blue tongue and
Yes.
always kind of talking about methylene blue as part of his nootropic stack and stuff like that. So he was definitely leading the way for people that listen to him, at least.
Yeah, he was one of our first main influencers in this whole world, Ben, for sure. And it was when we first came out with our product, blue cannatine, it was a highly visual product because the way we developed them is it's called a buccal troche. It's a dissolvable lozenge that's scored in the middle. So you can take like a quarter, a half, or full. And the blue cannatine was best and is best dissolved in the mouth because troches dissolved in the mouth are faster acting and the ingredients are more bioavailable. And so they bypass digestion, all that kind of stuff. And so people would be around there with blue mouths and showing the world that they had their blue mouth. But that also is something that we've realized over the years that if you're taking pure methylene blue, you don't have to dissolve it in the mouth. You can just swallow it because methylene blue itself is so bioavailable, meaning that so much of it gets in the system. You don't have to worry about first pass metabolism as you would a lot of other ingredients. So some of our other products are much better dissolved in the mouth because of that potency issue. But I mean, this is the nature of almost everything that we swallow when it comes to supplementation. The bioavailability goes down dramatically, but not for methylene blue. So you can take it on an empty stomach and you still get the same mitochondrial benefits.
So I'm just curious, and this is just my curious mind. You said methylene blue concentrates in the mitochondria. Has
It
anyone
does.
actually looked at the mitochondria to see if it's turned blue?
So if you take a cell and you squirt some methylene blue on it, and the cell is still alive, it's going to concentrate in the mitochondria. This is well described. This is where you can look at it from biochemistry class and see this, but it doesn't remain blue. I mean, what happens is that it cycles between blue and colorless until its half life, and then it starts coming out of the body. So early in the 2025 timeframe, when things got very popular, there was a paper that was put out that everybody taking methylene blue is going to have a blue brain because of this, because methylene blue concentrates in the mitochondria. This is funny on some level, but not so funny on other, because what they did is they took autopsies of people that had gotten very, very high doses of methylene blue right before they died, and their brains were blue. And the whole thing was about, having a blue brain. So these are people that were using methylene blue in emergency settings, IV, intravenously, for very, very serious things like for cardiopulmonary arrest, basically, septic shock, things like that. And they all got around 300 or more milligrams of IV methylene blue over several hours, and then all died. They weren't, this is like a last ditch effort to try to save their life, giving this methylene blue. And then they had these autopsies with blue brains. But low doses of this it's not going to happen. Okay. I would even venture to say if those people had survived, their brains would have been back to their normal color within a couple days. So because methylene blue is just recycling itself, and then coming out of the body. So it's one of those things where you use it in chemistry class to visualize the mitochondria. And so it's absolutely something that you can see real time if you had a cell in front of you.
So those people, though, they were using very high doses that the
Yes,
majority of us would not use. Then the tissue died. So then the tissue wasn't metabolizing
exactly.
methylene blue. So it just hung about. It just stayed there because there was nothing to break it down.
100% exactly. Yeah. So we use very low doses. We're talking about clinically for me, I'm using 4 milligrams to 25 milligrams for mitochondrial support, and maybe 50 to 150 milligrams for more infectious support in using methylene blue. Where in this study, they were given 300 milligrams on average IV intravenously. So double the dose, or triple or quadruple the dose that I would give on most occasions as well. And then, of course, as you said, the brain stopped metabolizing everything. So the methylene blue stopped metabolizing too when they died, the person died.
So I have a few questions that I know are more relevant to my audience right now.
Yeah.
First,
Yeah.
you mentioned the brain fog, the neuroinflammation, that cognitive performance, and immediately I could hear all of my perimenopause followers going, "Hold on, what's that? Can that help me?" So, as you know, a lot of women, as they transition through perimenopause into postmenopause, there's a lot of neuroinflammation on every level.
Hmm.
Not that we're saying this is your only option, but could methylene blue be an option for women who are experiencing like severe cognitive performance issues and issues with memory recall and stuff?
I'll give you a good example of this exactly. So I had a colleague of mine reach out recently. She does a lot of HRT with her patients, perimenopausal patients. And she's like, Scott, I put them on estrogen and progesterone, but it still wasn't moving the needle until we started methylene blue. Their brain fog finally went away. And I've seen this countless times because certainly I think that repopulating the system with hormones that can be helpful, I think HRT can be helpful for a lot of women. And thankfully that black box warning has come off here in the United States, which I think is a great thing. It may not be the only answer. It may not be the only thing that people need. And oftentimes it's not, because there's still going to be mitochondrial stress that's going to be going on with those hormonal changes that are happening, even if you're giving exogenous hormone replacement. So I've seen this almost hands down be helpful in that particular population, both with brain fog, concentration, energy, mood stability, and also sleep, which is interesting, right? Because you wouldn't think that something that gives you energy would also help you sleep. But if your brain has more energy during the day, then it's not as wiped out in the evening and it can actually recover. And so I've been surprised. I mean, I remember talking to a couple of colleagues and then also a couple of my own patients where they're like, Scott, or Dr. Scott, whoever's talking to me, they'd be like, I took your methylene blue in the morning and I slept like a baby. I'm like, huh. And then I took your methylene blue in the morning and my HRV went through the roof. I'm like, oh, interesting. And it dawned on me, right, that this is really a mitochondrial stress relief that we're allowing, with the methylene bluing on there. It's and certainly not the only thing that I'm doing. I'm in my clinical practice. I know in yours too, Shemaine. Like we're optimizing people on the foundational level, looking at vitamins, minerals, nutrients, diet, lifestyle, stress as best we can. But sometimes we really need to kind of pull a lever, right? Really help somebody now. And that lever, I mean, I've just seen it time and time again with methylene blue. And we're not talking every day for a lot of women. We're not talking about high doses. Sometimes we're talking about most days, sometimes, and that's okay. But I've really seen just a huge capacity just to change the the angle of accelerated improvements. You know what I mean? It's like you're on a trajectory, you're doing okay, but all of a sudden we kind of like move it up. Like now things are getting much better, right? Faster, and that's what I can see. And like we also have a product called Blue Canatine, which is a combination with methylene blue, nicotine, and caffeine, low dose nicotine, low dose caffeine. And that one is like brain fog resolution 101. It's like you have brain fog, this is going to go away. And so, absolutely, I think it can be part of that. And not the only thing, 100% not the only thing, but definitely a very big lever you can pull.
I wonder because a lot of the women I work with. So first, do you know how much your colleague was using to help these perimenopause women? Like what dose?
Yeah, yeah. Low doses of methylene blue. We're talking about 8 to 16 milligrams of methylene blue, either every day, every other day, 3 times a week. A little bit for everybody, it's a little bit different. I always say that the more stress your mitochondria are under, the more frequent you require methylene blue, especially in the beginning. But hopefully, over the long term,
Which
you
is
can wean down.
everybody.
Yes. Yeah, we all have it, right? And I'm going on a plane in a couple hours here. And I'm loading myself up with some methylene blue because when you're on an airplane, you're also stressed, right? You're pressurized on most planes to about 8,000 feet above sea level. And that's a low oxygen environment. And if you live at sea level, that's a big stress, especially. And so what methylene blue can do is actually can compensate for that. It actually can work just like oxygen on some level to maintain your capacity to make energy, decrease your inflammatory load. And so you get to your destination and feel much better. I get at least an email every other week by somebody that told me they went on a plane and somehow they don't have jet lag using it. And so it's very, very common to use it that way. Because you're right, we're all under stress all the time, kind of, right? But if we're more optimized, we need less additional capacity, that's for sure, but we can still use it, right? And then I think over time, that's the goal is to get people on less of it, just on the days that they need it rather than, more of the days because they need it more days, that kind of thing.
So I wonder with these clients or patients of yours that you've seen and they've mentioned their sleep has improved. One
Yeah.
thing that's very common in women with not with perimenopause, like it's a disease, but going through perimenopause
During. Yeah.
is
Yeah.
they have very high adrenaline, and that's what impacts them when they go asleep. And one of the key ways that, say, exercise or optimizing nutrition helps is because it helps with that mitochondrial action where we metabolize adrenaline a lot faster, which is kind of what we see with kids with severe ADHD or autism
Sure.
that if you can get them to like bounce on a trampoline or something for an hour or two, you can help them to burn off that adrenaline and then they're more likely to sit in the one spot for a while or sleep through the night. And I wonder if that influence that methylene blue has on mitochondrial action is actually, and I'm sure it is because I think you've already touched on this, is helping the body break down and metabolize the excess adrenaline, which therefore also helps women get into better sleep too.
Yeah. What I would think about it. So with methylene blue, what it's really looking at doing is supporting mitochondrial function, right? And one of the reasons why the adrenaline's going out at the levels that it is that you're trying to compensate for poor mitochondrial function. So when the mitochondria aren't making as much energy as you need, you're going to try to rev up the capacity to make more energy. And that requires revving up your sympathetic nervous system, which gives out more norepinephrine, more epinephrine, noradrenaline, adrenaline, and more cortisol. And so what methylene blue can do is come into the mitochondria and say, everything's okay.
Hmm.
We have enough energy. You don't need to keep pushing so hard, right?
Yeah.
And as a result of that, less is going to get pumped out of the adrenaline because the mitochondria are more supported. Now, that doesn't mean you still don't have to work on why there so much stress is happening. Like what are the external stresses that are happening that are causing, the stress response for sure. But by supporting the mitochondria there, you're taking the gas pedal and you're putting on the brakes a little bit. And as a result of that, you're not going to have as much, norepinephrine and epinephrine out there to deal with because of that.
Does this also mean because of its mitochondrial action and its anti-inflammatory benefits that it can be, as we would say, pro-thyroid too, helping to optimize thyroid function?
I have seen this in some of my patients where they require less thyroid medication over time, taking lower doses of methylene blue. What it seems to be able to do is increase the conversion of T4 to T3, although this hasn't been studied, at least just
Hmm.
in clinical experience. I've also seen it decrease your thyroglobulin and your other antibodies, that are related to Hashimoto's and others as well. So your TPO as well. And so I've seen the antibody levels come down as well. And I think what it comes down to, it's kind of probably sort of manyfold here, but I think like a big part of it is just increasing metabolic rate, and having the capacity to make more energy, but also doing this without causing a lot of stress on the system. Like the thing about our mitochondria is that they're like gasoline powered engines. They make energy, our ATP currency, which is our energy currency called ATP. But we also make carbon dioxide when we make ATP, and we also make reactive oxygen species, or ROS. And some of these reactive oxygen species are really helpful because they can tell the mitochondria how much energy to make, and they're signaling and sensing and things like that. But we need antioxidants in the body to be able to neutralize this reactive oxygen species. That's a gasoline powered car because we have this exhaust, okay? And we need antioxidants to help neutralize that. The thing about methylene blue, which is very interesting, it's more like an electric powered vehicle. It doesn't have exhaust because it's its own exhaust. It can help you make energy more efficiently. That energy production is also at the same time not stressful because you have methylene blue working directly as an antioxidant as well. And so it has the capacity to make energy and detox. So I tell my patients all the time, think of methylene blue as energy and detox, energy and resilience. So you get the energy, but you don't get the downside of making energy, which is really great because a lot of our patients can't really tolerate making a lot more energy because when they do, they crash. This is like your caffeine crashes. This is like you're trying to give yourself more energy, but then you pay for it later.
Hmm.
With methylene blue, you don't pay for it later because you don't have that load of reactive oxygen species that can happen under normal conditions. And we become more antioxidant deficient over time as well, and more toxic over time as
More
well. And then you have
inflamed.
more,
Yeah.
yeah,
So in itself, I would argue it's part of its anti-inflammatory activity
right.
is also helping with the conversion aspect of things.
That's a great point, right? So when you're decreasing the load of inflammatory, signaling molecules, of inflammatory load in general, you're going to get better capacity for sure.
Mhm.
So I think of detox as inflammation, right? So if you have better detox capacity, you have less inflammation. So sometimes I'll tell people more energy, less inflammation, more
Mhm.
energy, better detox,
Mhm.
more energy, more resilience, like depending on what's going to be most resonant to the person. But in essence, more energy and less inflammation is going to make a system work better. More positive things in general, better brain function, less inflammation, so less pain too. So even people with chronic pain, I've seen dramatic improvements using methylene blue because we're working on that inflammatory side of the pain, right? And so people don't think of pain as inflammatory sometimes. Sometimes they do like acutely, but like a chronic pain, there's always going to be an inflammatory component and always an immune system dysregulation component. And when your immune system is under high inflammatory load, it doesn't work very well either. And so when you take off the inflammatory load from the immune system, it's going to work better too. So you're going to feel better. And so that's why I feel like it's such a universal bridge for so many people where it brings them from where they are to where they want to go and helps them across all those bottlenecks, across all those blockades along the way that would have made them difficult to continue to optimize their health, change their diet, get out of a bad relationship, go for a walk around the block. If you don't have enough energy, it's really difficult to do those things,
Hard to
right?
do anything. Yeah.
Yeah, yeah. So just a little bit of extra bridging then it's like, oh, I can do that. I can stop going to McDonald's 3 times a week. I can stop drinking my bourbons or my whiskey, whatever. Like I can start doing these things, little exercise, just because I have more capacity. The reserve is what we want. We want our patients to have an energetic reserve, the capacity to be able to rev up when we need to, but then downshift when we are supposed to, which is most of the time. And you can't downshift well if you're in this inflammatory load that happens with almost all of us these days: insulin resistance, toxins in our environment, medications we take on a regular basis, this sympathetic activation, infections, post-infectious syndromes. Like there's so many different things that are causing this. It's very difficult, but not impossible. And I think that's what I try to give people as a hope. It's like, look, you are where you are now, but we can get you there. It's going to take time, and we just have to give you things along the way to prevent you from having the off the wagon kinds of feeling, right? And that's hard, but it's certainly doable. And I think methylene blue is a great bridge in that capacity.
So you've mentioned the viral activity and
Hmm.
immune support and antiviral, and earlier you mentioned malaria and some of the original treatments. And I have, just as we start to wrap up, this question for you. And I mentioned I had a question regarding a client of mine, and it comes right in here, like these go hand in hand.
Yeah,
And I've heard you before in other conversations mention that methylene blue can be used as an antiviral for Epstein-Barr virus. And I'm wondering how that works. Like, what are we looking at for dosages and utilization there in someone who has like a chronically active or reactive, as they put it, Epstein-Barr virus? Like it's always this low grade. She's always got the sore throat, the swollen lymph nodes, the headache,
sure,
aches, pains. If she even like goes grocery shopping, that is considered overexertion to her body, and she will pay for that for like a week. So we maybe get one good week a month, and the other 3 weeks she's recovering from that one, and it's just awful. And she also has Hashimoto's, which I kind of said, well, I there's clearly a connection there between Epstein-Barr and
there
Hashimoto's.
is. Yeah,
But so that's the first part of the question. And the second part is that when I did try this client on methylene blue, she was taking it orally. I believe we started pretty low and we didn't get higher than 15 milligrams. So it was still pretty low. But she had some reaction in her liver where she got severe liver pain. Like I was concerned. I was like,
mm,
maybe you need to go to urgent care. Her liver seemed to swell up. It felt like a fist in her side for days.
mm,
She could not lie on her right side at all. Like it was clearly a flare. And at the same time, she got a head cold. So I was like, oh man, it's a bit hard for us to say now if this is just a reactivity to the head cold. But she was convinced it was the methylene blue. So when she stopped the methylene blue, over a few days, then that liver pain went down. Of course, I did my own research because I knew we weren't talking for a while.
sure.
And there is instances where there's already liver damage. It can cause a flare. Anyway, I don't want to keep going on. What's your opinion on this?
It's an interesting case. I mean, I think that a couple of things come to mind. I think the first one is that, most of these viral reactivations are reactivations, right? So you had this infection, a mono infection when you were younger. What we all do is we don't ever get rid of viral infections. They stay in our body in various places. And when our immune system gets dysregulated, that's oftentimes when they reactivate. So common when people get, acute mold infection, that they get a reactivation of Epstein-Barr. If they had an acute COVID infection, they get reactivation of EBV and Lyme and mold and all. We've seen a lot of this over the last 4 or 5 years. So the first thing I think about here is not direct antiviral care. And you were kind of already going this way, which is more, focused on immune system optimization, right? And I think that's where I would go with somebody like this. The other piece of it, when I think about adding methylene blue in, I think of with the mitochondrial support is low doses, right? So somewhere between 4 and 25 milligrams. So you around that dosing. When it comes to more antiviral dosing, antimicrobial dosing, that's typically higher, typically around 50 to 150 milligrams, depending on the person, depending on the acuity of methylene blue, somewhere around 3 to 14 days, depending on the person and what they're doing. In this lady's case, I probably wouldn't have given the high dose. I would have gone exactly what you would have done. And my goal would have been to slowly increase her dose over time to see how she felt as we were going. Um, Quality is a big part here. So depending on the type of methylene blue you're getting, you have to be super careful that the liquids out there, for the most part, are not as potent as they say on the label, and also can often be contaminated with heavy metals like lead, mercury, cadmium, and arsenic. And even if it comes with a pharmaceutical label, you can still be surprised at what's actually in some of these methylene blue. In fact, I just got one across my desk that was like super high in arsenic, by the way. So you just don't know sometimes, even if it says in the label, because what a lot of these companies are doing is just saying what their certificate of analysis says that came from their manufacturer. So they got the methylene blue from out of country. It doesn't come from the United States, doesn't come from Canada, it comes from other countries. And then they just take that certificate of analysis at face value without testing it themselves. So we test everything again. Once it comes onshore, we get ours from Japan and Korea to make sure that it's exactly the methylene blue that we say every single time. If it doesn't meet the specs, we throw it out or we give it back to the manufacturer and we get another batch or whatever, right? And so I think quality is a big part here. So that's something that, I think about for her. And then, if you kind of take all those things away and say, okay, what could this be, right? So detoxification in general takes a huge amount of energy, right? Liver detoxification especially. And if she's under a lot of detoxification or a toxicity load already, in some people like this, I start off at even lower doses, somewhere like 2 or 3 or 4 milligrams of methylene blue for a little while before I start increasing the dose. Because when you do, you can start getting detox reactions. And this sounds like exactly like a detox reaction where she got maybe liver inflammation. It's hard to know without testing and imaging and things like that. Certainly a viral infection or a cold at the same time could be a detox reaction. So these all things make me feel like she was having some sort of detox reaction to the methylene blue itself, where in these cases, what I would probably be doing is revving up her detox pathways, getting good antioxidant capacity up there, things like glutathione, alpha lipoic acid, and also getting binders and make sure she's pooping every day, because those are really big with all this. But even if all that doesn't work, then the next step for me as well, what's also most likely happening here, and probably already happening, regardless if the other things help or not, is dramatic sympathetic activation. Oh, yeah. Somebody that has dramatic fight or flight at all times. And if you're in fight or flight all the time, you're not going to heal. No matter how much methylene blue I give you, it's not going to help. In fact, it might make you worse. And these are patients that I've seen over the years that I know I'm not going to be able to help them with just, with mitochondrial support. So my sense of this overarching, probably the elephant in the room per se, would be, chronic sympathetic activation that needs to be addressed at the same time as doing any other, and maybe you're already doing this, but at least that's what I think about as you kind of go through the case.
Is there, and we're finishing up now, but is there any other contraindications apart from if someone has overactivation or potentially liver damage already? Are there any other contraindications where we wouldn't or we'd be careful with methylene blue?
If you're pregnant or breastfeeding, you shouldn't take methylene blue. If you have high blood pressure, your blood pressure may rise taking methylene blue. Sometimes it can go down, but oftentimes it can also rise if it's not well controlled. So I'd recommend just being mindful. If you're going to take methylene blue, if you have high blood pressure, you should work with a practitioner. You should at least be checking your blood pressure 1 to 2 hours after taking the methylene blue to make sure it's fully, to make sure your blood pressure is not going fully, too high or anything like that. Also, if you have kidney disease, because methylene blue is excreted in the kidneys, and so you have to have the capacity to excrete it. If you have chronic kidney disease, methylene blue is not going to make your kidney function worse, but it's going to stick around for longer. So you have to be aware of that. And work with a practitioner. And if you're on dialysis, you have no kidneys, then you should not be taking methylene blue. People will get worried about serotonin syndrome and antidepressants and things like that, because methylene blue does increase serotonin and norepinephrine. But there's no risk of serotonin syndrome, which is very rare. But the combination can increase blood pressure if you have high blood pressure and cause some GI distress. So it's important to work with a practitioner if you're on an antidepressant like Paxil or Zoloft or Effexor or things like that, because they also increase serotonin, especially in the gut. That's where you have most of your serotonin. That's why you can get some GI distress. But other than that, low doses are extremely safe. I just recommend going slowly with the dosing, titrating it slowly. So we have our Just Blue, for example, at prescriptions. You start off with 1/4, which is 4 milligrams, a couple days, 3 days. If you have no effect, then go to 8, which is 1/2. Taken on an empty stomach is best, typically in the mornings. It can increase your energy, and that's what it likely will do. Even if it does, hopefully it does, it won't keep you up at night. usually, but some people will have a difficult time falling asleep. So I don't recommend taking it too close to bedtime typically.
And if they're being cautious, maybe start at an even lower dose and titrate
Yeah.
up and see how your
Yeah.
body responds.
Yeah. So 4 milligrams, which is a quarter of our Just Blue, is a pretty good starting dose for most people. Unless they're super sensitive to everything, then maybe taking that and cutting into a half and taking 2 milligrams
Mhm.
would be the way to go. But I mean, the majority of people that I work with, I start off at 12 and a half or something like that. So, but I think 4 or 8 milligrams is definitely a good starting dose for most people.
Okay, Dr. Sherr, that was like methylene blue 101.
There you go.
Thank
Yeah.
you for your time today. Where can people find out more about you? You've got a great Instagram page, which is quite popular.
Well, thank you for having me, Shemaine. So Transcriptions is the name of the company. TRO scriptions, like the word prescriptions, but a TRO in front of them, in front of the word. And you can check it out at transcriptions.com. We have a product called Blue Canatine, which is the combination with nicotine, caffeine, CBD, and methylene blue. That's a focus formula. It works brain fog. It's not a problem with that particular one. Also, we have a Just Blue. We also have a suite of other products that are based on the GABA system, so calming down brain firing, TroCalm, TroZ, something called TroImmune, which is great for the immune system. And then you can also find my work at Dr. Scott Sherr, DrScottSherr. That's my Instagram page. Also, that same handle.com without the at symbol in front is my website. You can find my consulting for many things, hyperbaric medicine and health optimization medicine, which is the foundation of my clinical practice. One Base Health, which is another company that I help run. Yeah, those are the places.
And there's loads of content with you on YouTube as well. You're everywhere.
Well, thank you for having me. My goal is to educate, and I'm a clinician. I really try to do this from a clinical perspective, and I appreciate you doing the same thing, Shemaine. So thank you for having me.
We try, we try. Well, safe travels today, Dr. Sherr, and thank you for your time.
Cheers. Thank you.